Hello guys, I'm Shanmugapriya, your lecturer from SNS College of Allied Health Science, from the Department of Operation Theatre and Anesthesia Technology. We have already seen in the past two sessions about fibula as well as tibia. So I have given a summary about fibula in the previous class, and we have just started with the tibia based on its introduction as well as location. So to sum up, I just want to say tibia is a bone which is the second largest bone in the human body, and it is usually located in the medial aspect of the body. That means it is towards the midline, and then it is a primary weight bearing bone of the leg. It also forms the knee joint with the femur and ankle joint with the talus. On the location, we have already mentioned it is a medial bone, and also based on the parts, I just want to say that it has mainly three parts. One is proximal end, another one is distal, and another one is shaft. So this proximal end articulates with the femur, forming knee joint, and distal end forms the medial malleolus of ankle. And then we have already seen about the proximal end and their parts like medial and lateral condyles, tibial plateau, intercondylar eminence, and tibial tuberosity. In this class, we will be continuing with shaft and distal end. So basically, the shaft is a triangular with anterior, medial, and lateral surface. Interosseous border which connects to the fibula via interosseous membrane, and distal end medial malleolus, and articulates with the talus. The inferior articular surface forms ankle joint with fibula. And then for the side determination, we identify the side of the tibia, whether it is right tibia or the left tibia based on these 4 points. First one is medial malleolus. It projects medially at the distal end, and the tibial tuberosity, which is anterior and proximal. Interosseous border, lateral, and faces fibula. It orients with the condyles superior and malleolus inferior. So basically, these are the 4 main points to determine the site of tibia. Medial malleolus, tibial tuberosity, and interosseous border, and also about the condyles, which are present on the superior aspect, and malleolus on the inferior aspect. Next, on the ossification of tibia, I just want to say the primary ossification center, which is a shaft, appears at the 7th fetal week, while the secondary centers proximal during birth and distal at the age of 1 to 2 years. And then epiphyseal closure, that is proximal at 16 to 18 years of age, and the distal at 15 to 17 years. Clinical note is that the growth plate fractures may affect leg length. And then the blood supply, nutrient artery, periosteal supply. In the nutrient artery, we are going to deal with the branch of posterior tibial artery and enters the shaft. Periosteal supply, anterior as well as the posterior tibial arteries. In the proximal end is supplied by the metaphyseal arteries from the polypteal artery, and the distal end is supplied by anastomosis around the ankle joint. Next, applied anatomy, that is muscle attachments. So basically, quadriceps and sartorius muscles are attached to the proximal end, while gastrocnemius and soleus and tibialis anterior is attached to the shaft, and ankle ligaments like deltoid ligament, which is attached to the distal end. Then their main function is knee flexion, knee extension, ankle dorsiflexion, and plantar flexion. So these are the main functions that this bone performs, tibia performs. Clinical relevance is that mainly fractures occur at tibial plateau due to knee trauma, and in the fractures in the shaft is due to high energy trauma. Medial malleolus fractures, which are common in ankle injuries, and tibial stress fractures overuse in the athletes. Compartment syndrome is due to the tibial fracture swelling. And then about summary and key points. This tibia is the primary weight bearing bone of lower leg, and it is the second largest bone of the body. Parts is that it consists of condyles, tibial plateau, shaft and medial malleolus. Ossification is that the primary center in the fetal period, fusion by 18 years. The blood supply, it is supplied by tibial as well as popliteal arteries. Clinical features are that the clinical relevance are that the fractures, compartment syndrome and ankle injuries. For more information, kindly refer these 3 books, Manipal Manual, Rosen Wilson and B.D. Chaurasia for more knowledge. Thank you.